watch your mouth.
All right, and welcome back. We are with our dental expert once again, Dr. Ryan Walker, and he always comes on HTV and sort of gives us some great information. So today is interesting because I've heard of TMJ all these years. Family members have had it. But when I looked at the name, and I'm going to let you say it, no wonder why they call it TMJ.
Right. So TMJ is the temporomandibular joint, okay, which is why, like you said, most people say TMJ instead of saying the name. And when you, for whatever reason, it's become known, problems with it have just become known as TMJ. Everybody has one, so not everybody has problems with it. So the actual term for problems with it is temporomandibular disorder, or TMD. So it's like saying, you know, I have foot. No, everybody has foot. You just don't have problems with your foot.
Right. There you go. Well, I'm glad you clarified that. But
right,
as we narrow it down, you know, when you have spine problems, you have symptoms. When you have foot problems, you have symptoms. Any particular symptoms that come along with TMJ?
Yeah. So there's a lot of things attached to it, right? Teeth, muscle, and joint. And you can have symptoms with all or just one of these areas. So tooth symptoms, TMJ or TMD tooth symptoms would be tooth wear. You could have, you know, worn teeth. We did that on the last episode. Mm-hmm. You can have fractured teeth from clenching and grinding. You can have cold sensitivity, bite sensitivity, mobility, meaning, you know, the teeth are become loose from grinding on them. It can actually move teeth. So it can be like an orthodontic movement where, you know, braces move teeth with force and time and space. If every night you grind on your teeth, it will move them. It will start to push them and move teeth around. So if you find that your teeth are moving, starting to open up and stuff like that, probably due to clenching and grinding your teeth at night.
I've heard people, I've been around people that actually will be eating or they'll stop and they'll go, something just popped.
Right. So yeah, clicking and popping is, that's more joint stuff going on. That's just the cartilage disc in there is just moving around in places that it probably shouldn't be.
Ouch.
And making noises. Sometimes it's not painful. A lot of times it's not painful. Typically, you don't get too concerned with the noises until they start to cause some problems, right?
And most people will obviously know when it's bad enough to go see.
Well, a lot of it's misdiagnosed. I get a lot of referrals from ENTs where people think they're having an earache or ear pain, and come to find out it's actually joint pain. So that's some of the joint symptoms would be, you know, derangement of the joint. You could have a limited opening. You can't open it. You could be locked closed. You could be locked open. You can have ear pain, tinnitus. It can cause ringing in the ears because the joint's right up against the ear there, and it's just a lot of stuff going through there, nerves and stuff. And if it gets inflamed, it can cause ringing in the ears.
It's an isolated area, but there's a lot of things around that area.
Yep. You can have headaches. If it becomes deranged enough to where it's inflamed and things really get out of place, you can actually have teeth where they misalign. Your teeth, you'll bite and go, I mean, my bite's not right, and that can be caused from the joint inflammation.
It's definitely something to keep, you know, an eye on for sure. Right. What are the causes of TMD?
TMD, it can be stress, misalignment of teeth, dehydration. Alcohol, believe it or not, can increase the chances of you clenching and grinding your teeth.
If it's stress, everybody has TMD, right?
Everybody, right. So if you couple stress with teeth that aren't properly aligned to come together properly and then move past each other properly, that's going to increase the chances of you clenching and grinding at night.
All right. So how do you treat TMD?
TMD, hopefully, all you need is a night guard. All right, which we've shown on the last episode. It's something you wear at night. It's an orthotic device. It works in harmony with the joint, puts the joint where it's supposed to be, and gives you an ideal bite, basically. For the majority of people, that's the end of treatment. Usually with nighttime wear of that orthotic device, that's going to resolve your symptoms, and you'll get healthier. You'll get more range of movement. You'll get less headaches, less tooth mobility, sensitivity. But for a certain percentage of the population, that won't do it. You have to go into more serious stuff like wearing the night guard full time to resolve symptoms, and then possibly orthodontics or some crowns, maybe even some orthognathic surgery where you do jaw surgery.
And I would imagine you probably recommend to people not to eat too many chewy foods.
Right, exactly. So if that's one of the things you can do to help with the pain, if you're having problems, I tell all my patients, You can do 800 milligrams of ibuprofen every 6 hours. Stay away from chewy foods. Don't chew gum. Once you have these symptoms, don't chew gum ever again. It's only gonna make things worse. Stay hydrated. You know, the muscle problems, a lot of the muscle problems are just from not staying hydrated, muscle spasms and things like that.
Yeah, real quick, got about a minute left, but mostly older people, or we have younger people that get this?
All of the above. This could be big population as females, post-orthodontic, females out of braces, just starting college, just kind of getting into life a little bit, having a little stress, maybe your first set of exams, maybe you break up with your first boyfriend, and that's a large part of it is, you know, females tend to not tolerate it as well as males do. Males will wear out your teeth. Females typically have pain and joint problems. But also older people. A lot of people who have tolerated their whole life, like everything else in our body, as we know, things start to break down and don't heal as well or don't tolerate, and they're not as adaptive as we get older. So somebody that's clenching around their teeth their whole life could be in their 50s or 60s, and all of a sudden they start having joint problems or muscle problems, and it's just the body's finally telling you, all right, I can't handle it anymore, I can't adapt, do something about it.
So not only a dentist, sometimes a psychological factor comes in.
Right.
Stress-free. We need people to be more stress-free.
It helps. Yes, sir.
All right. Well, Doc, thank you for coming on. We appreciate it, and look forward to the next topic.
Thank you, Martin.
All right. Once again, Dr. Ryan Walker. He is our HTV expert. He's a dental expert. He's a doctor. And if you have any concerns, give him a call. Let him check you out, and he'll put you on the right road. We'll see you again next time.
Watch your mouth.